Good morning, everybody, and welcome back. This is your lunch break. My name is Ivana. If you are new here, if you're not, welcome back. Thanks for coming back. And today we have been covering a lot of back to school topics in the last couple of weeks, both here on this show and also on AL.com. But we're going to be talking today a little bit more about some of the colleges and their reentry plans, and specifically the GuideSafe plan that most Alabama universities and colleges are using to get their students back on campus safely. And we had some reporting that came out yesterday from AL.com's own Michael Casagrande, and he's joining me today to talk a little bit about that reporting, which showed that early test results from these required COVID tests from the students coming back to campus have really been, I think, surprisingly showing mainly negative results, that these students do not have coronavirus. Michael can share those numbers with you in just a minute. We're also going to link his story here at the top of the comment thread, so you can go and read for yourself some of the things we're about to talk about. If you have questions regarding how students are feeling about going back to campus or any part of this reentry plan, let us know. We will talk about them as they come in. So, Michael, thanks so much for joining us today. And first, tell us a little bit about what we know so far about these COVID tests that are required for students coming back to campus.
Right now, it's a $30 million project, part of the CARES Act, that was dedicated to testing every college student in the state of Alabama before they go back to class. And it's been crazy the last few weeks. They want to have everyone with the UA system, the 3 campuses, to have everybody within 14 days have a COVID test to come back negative. Requested yesterday just the numbers from the GuideSafe people about what's the positivity rate, how many people have been tested. And with classes starting next Wednesday, they've had approximately 30,000 people go through the testing, whether that be through the 14 sites on in-state or the mail-in kits that are going out to students who are mainly designed for those who are out of state. And the numbers that came back was 0.83% of those 30,000 tests came back negative. Or those were the positives. So it's about 250 people out of those 30,000 came back with a positive test. So in that sense, it's a positive thing for the reentry program.
Yeah, that's a really low number. Of those 30,000 tests that they've already gotten in, of those coronavirus tests, you said there was about 249 tests that came back as positive cases for coronavirus. That's a pretty low number. Did the GuideSafe officials that you got this information from, did they express anything about maybe whether they were surprised by that low number, or was that kind of on par with what they were expecting?
It's a good question. I didn't necessarily ask that. I just kind of got the raw numbers. So I didn't, it's hard to say what anybody would be expecting at this point. The positivity rate among the general population is much higher. But I guess you would presume that the people, others, this is a required test. So everybody, whether you've been exposed or not, would be taking it. And whether, the general population, probably more people are getting tested because they were exposed or feel like they might have symptoms. So the statistical analysis of it is, it's all up for interpretation, but it's a pretty low number for the numbers that they had. And they said there were 35,000 or so tests in the pipeline being processed at the time. So hopefully we can get some updates on those numbers, see where they go. And, it doesn't include every test. There are students that I've talked to who were getting tests at their local urgent care. A student in Wisconsin I talked to got a test at a National Guard. So it's only the tests that are going through the official channels, and those tests that from other places the results can be sent into the universities to be cleared to reenter. So you don't have to go necessarily through those 14 on in-state sites with a mail-in kit.
So we know that GuideSafe is being used at most all Alabama colleges and universities, but we also know that some of our bigger colleges, University of Alabama, UAB, even Auburn, these places have a lot of out-of-state and even in some cases international students. So a lot of these out-of-state students, what they are being asked to do is complete a mail-in coronavirus test kit. Tell us a little bit about what the students who live out of state that you talked to, what their experience was with this mail-in test kit.
Yeah, no, it's interesting because there were a few that I talked to, two in New Jersey who couldn't get the test, couldn't get it mailed to them because of state laws. New Jersey, New York, Rhode Island are the three states that prevent that's illegal in a sense to have those kind of tests mailed to them. It has to go through a physician, so the traditional mail-in tests can't be done in those states. And so they were scrambling, trying to find a place, a local general practitioner. I think one of them went to a pharmacy, and they said they couldn't be tested unless they had symptoms. So, it can be a challenge. The student I talked to in Wisconsin had followed the instructions, sent the email. They said that the kit would be in the mail, and he had to get back to campus, and it never arrived at his house within 7 days to take it and to send it back. So he went to the National Guard and took his test and came back negative. So, it's a patchwork thing. It's kind of been thrown together. There hasn't been a whole lot of time to practice it or test it. So there are going to be some issues for sure. But from the people I've talked to, a very small sample size, they've at least figured it out. They've worked around it if there were issues.
Getting a comment here from Dee Dee. Yes, most of these tests are negative. If you're just joining us, we're talking about some of the early data from these coronavirus tests that are being collected by people coming back to Alabama colleges and universities. And that number, again, of those tests so far, the data that Michael was able to collect is 30,000 students have returned their test to the GuideSafe program to be tested through that program. And of those 30,000, 0.83% were positive for coronavirus, which means about 249 tests of those 30,000 were positive for coronavirus. So it's a pretty low number there. Michael, this is a question I've seen a lot of people talk about on social media and just also have heard in conversations that these mail-in test kits are intended to be used by the student and performed by the student. So that means we're depending on some of these college students to administer their coronavirus test themselves and mail back those results. What have you heard about maybe the reliability of these tests that college students are performing?
Yeah, I was doing some research on it. It was the company they're using, Everly, was one of the first companies that was approved by the FDA to do these at-home tests. If you remember, there was a whole wave of tests early on in the process that were deemed unsafe or unreliable and were shut down by the FDA. And I think Everly was one of the first ones to get approval. But yeah, I mean, I can't personally say I know how it works or I've used it or talked to someone. People I try to talk to were unable to get their kit. So that was a good question that I wish I could have answered from some of the students who try to take it. But yeah, I think they're trying to limit that to fewer people. They want as many people to go in person. I'm sure there's availability issues with the mail-in tests. So, we'll have to keep researching, keep talking to people and see how it actually works.
We can talk about, have a little fun fact here of the day is that company that GuideSafe is using for these mail-in test kits. Can you give us that fun fact, Michael, we were talking about earlier?
Yeah, no, it was interesting. I was doing some research on it and found that they were they were a smaller company and got a big infusion from going on the show Shark Tank. I think it went from $2 million in revenues to 60, 70 million. So it kind of took off from there, and some companies are positioned for a pandemic like this. I'm not sure they were planning on this being, a way to really hit it bigger. But a case like this, a pandemic where they have the capability to set up a test and have it available to be mailed out and mailed in. I think it's a business success story within this unfortunate time.
Right. And if I do remember at some point actually seeing that episode, and I believe that Mark Cuban was actually the shark that invested in that Everly company that GuideSafe is using for the kits. Let's transition and talk about how this is going to affect students actually coming back to campus, especially those who live on campus. I think that we've all probably experienced in some form or fashion dorms, and dorms are not a easy place to social distance and even really to keep that clean and sanitized. So what do, and if the negative coronavirus tests, are they going to have any impact, do you believe, on the way that this reentry plan is actually going to work on campuses?
It's a good question. I think they're all still trying to figure it out. Yeah, I talked to a student yesterday, a freshman coming in from Hartselle, and she was confident that it was going to be safe in her dorm, that she knew who she was living with, and everybody she was going to be around was going to be safe, was going to be taking it seriously, because it comes down to their different beliefs, and when you have a huge campus like that, there are going to be some people who are going to trust what they're told, and they're going to, in a sense, do as they're told and follow the rules. And she's been on, a group meet that says that there are people who are not trusting it and that are going to do what they want to do. And it's going to be that kind of constant push and pull within, students and university of, trying to police those who are stepping out of bounds, in a sense, and trying to keep everybody safe, to keep those outbreaks from happening on campus, because it's a place where, it can spread quickly if things break down in that sense.
You talk about that group message. We can say that one of these students with some of the students saying they're not going to take it as seriously, and a place where thousands of people are going in and out of every day. That is, maybe if you have just a few people who are not taking it seriously, as this student mentioned to you, especially living in a dorm, it can only take a few people to really kind of spread that virus around and get a potential outbreak going. Have you talked to people who are worried about that, students who are concerned?
Definitely. I mean, I've talked to 5-6 different students who are on their way back from freshmen to seniors, and there's definitely concern. There maybe only one of them wasn't very concerned at all. So it's weighing the risks, weighing the probabilities of not getting sick, not getting others sick, and that's kind of the other concern, is not necessarily them getting sick, but being able to pass it along to others that they encounter. That it's not just about you; it's about everyone you're around. So it's complex. It's not something I envy for college students. For this freshman who's, I remember going to school for the first time, that, going to campus, moving in, it was enough anxiety and tension and excitement and everything. And then you had to add in this dynamic of a global pandemic of, that nobody alive today really has dealt with. It's unfortunate. But, there are a lot of unfortunate stories in 2020.
You're too right about that, Michael. And you talk about that anxiety that so many, especially college freshmen, are already dealing with. For one, when I was doing my college orientation, I had to have my mother come on campus and help me register for classes because I was so confused. So, my heart goes out to everybody going through that. And especially, it's hard, like you said, in a normal year, let alone in a pandemic. It's just a challenging time in life. Now, talking about these freshmen, I actually talked with somebody the other day who's going to an out-of-state school, but she said that she, similarly to the GuideSafe program, had to take a coronavirus test, a mail-in test, and she took it, she sent it back, and apparently the university never received that test. Are we having any of those problems here in Alabama?
Another good question. We're working on it, trying to get as much as we can from the university. It can be challenging at times to get the information we're looking for, but that's part of it. I'm sure it's never going to be 100% with every test coming in. The communication, there's a lot of red tape, a lot of levels of the communication that some of these have to go through. That I'm sure when there's they're expecting with the GuideSafe 165 to 175,000 tests, that there will be some issues, and I'm sure it's going to be frustrating because everybody's kind of worn thin. Every system is taxed, so even the appeals process or what have you, it's going to be a challenge. And if anybody out there is experiencing that, feel free to reach out. I'm trying to talk to anybody who's had good, bad, any kind of experience to try to help the way this is implemented, because it's I guess our goal is just to help inform and keep everybody, in line with what they're doing.
Absolutely. And that's a good point. If you have gone through this experience and you're willing to talk about it, please let Michael or myself know, and I can get you to Michael or vice versa. Another question is, we know that this has been, as of I believe it was Wednesday evening when you got this data, there were 30,000 of those student tests that were factored into that 83.83% positive rate, with about 249 being positive. Classes are starting next week. How many more tests do we expect to see by the time classes start? I believe you said next Wednesday.
Yeah, well, with the UA students, yeah, it'll be next Wednesday. They said they adjusted their benchmark, their expectations for the numbers of tests that they were going to be processing to 165,000 to 175, where they were originally saying about 200,000. So it's a lot of tests. It's a lot of work to do, and the clock's ticking because they had to do it within 14 days of returning to campus. So there was you had to do all of this within a very tight window. So we'll see if they can, get through everybody, get everybody processed. There were some exemptions that if you had tested positive within 12 weeks, and if you could just prove your negative, coming out of the back end of it, the negative test, you didn't have to take another new one. But how many of those? It's probably a very small percentage of that 165 to 175,000.
Jimmy, this is actually Michael Casagrande. This is one of our reporters who is, I dare say, an expert on the University of Alabama in Tuscaloosa. And he's a sports reporter. He is also has been doing a lot of economics and campus reporting as well during this pandemic. So he's a jack of all trades here, Jimmy. And Jimmy, again, he says you're looking for the article. Scroll up to the top of your comments, and it should be there, the article that we're talking about that's explaining some of these early coronavirus test results. If you need the actual print news article, scroll up and it should be in your comments. Now, Michael, I want to talk really quickly about this. You said that students have to be tested within 14 days. And that is something a lot of people have asked about. We have Tyler saying that, sure, they can have their tests and be negative, but what about when they get to campus and they are exposed, or they go to parties, or do things that normal college students do? Is there a plan to continuously test these students, or is it just a one and done situation?
Yeah, no, that's a good question, a good point. And like I said to somebody, that the second you walk out of the testing center and that test you've just taken is almost obsolete, because you're now re-entering the world that, anything can happen from that moment after you take the test. So 14 days can be a long time for a test to stay current. But yes, there are some plans. It's called sentinel testing, that they're planning on testing groups within the campus once they get back. Not everybody is subject to it, but I think students who are on campus, they're trying to test like a representative sample. I think 2 or 3% of students when they're on campus to see if there are any kind of outbreaks, and quiet asymptomatic outbreaks going on. So it's not necessarily a one and done. Not everybody will get further tests. Athletics, those realms completely different. There's obviously much more testing involved there. But they're trying to, the sentinel testing is meant to keep an eye on things and make sure there wasn't another outbreak as best as they can.
That I believe, Jimmy, my wonderful producer, Monica, dropped a link, again, a little bit lower for that news article. So you could just click it right there, a couple down from your comments. We have another comment from Roy, who is an avid viewer of our show. So thank you for that, Roy. And he just makes a comment about masks. So I want to turn that into a question and ask you, what have you heard from students and their maybe willingness, or maybe their not willingness, to wear masks on campus?
Yeah, everybody I've talked to, the 5-6 students, are definitely planning on wearing masks. And the interesting line of questioning with one of the students was about others. Would they police? If they were in class, if they were in a hallway, would they say something to someone who was, not wearing a mask? Would there be much self-policing of this? Because I know that's a concern with faculty and staff. Are they going to be, along with teaching, are they going to be responsible for being the cop with masks? And he said he wasn't really sure, that he wasn't necessarily that comfortable with being that person to step up and say, you can't, you got to be doing this. He said he knows people with medical conditions that prevent them from wearing a mask. I know that's another one of those debated topics about, who's exempt from this kind of thing. So, with everything, there's nothing black and white, cut and dry. There are always shades of gray. It's going to be, very interesting to see how it works out on campus. It's kind of it's all kind of an experiment without much of a blueprint and not much of a history to go on. I mean, I still see, with football related things, people talking about 1918 and how, black and white pictures of people wearing masks, and there were anti-maskers at that time too. And there was a fight over who was going to be wearing a mask to prevent that flu pandemic. So it's, it's a tale as old as time, it's just, we all just kind of repeat each other.
Well, tale as old as time, and a song as old as rhyme as well. So, Michael, thanks so much for coming today and explaining this a little bit for us and breaking down that data. Again, Michael's story is linked in our comment thread here if you would like to read it. And I think a lot of these follow-up questions that we've been bouncing back and forth, I think, unfortunately, we're going to have to wait and see for a lot of those as well. This might be something that we have to revisit in several weeks, and I'm sure we'll know a lot more by then and probably have equally as many questions. So, Michael, thanks so much again for coming today. Thank all of you so much for watching, and we will see you tomorrow.